For a lot of people, just hearing the word Staphylococcus can put them in panic mode. A few weeks ago, a young lady walked into my clinic clutching a lab report tightly in her hand. It was her vaginal swab test, which has showed Staphylococcus species isolated. She was terrified. She begged me to give her a strong antibiotic. She said she didn't want to become infertile or lose her future husband. But here's the truth. She didn't even have any symptoms. No fever, no pain, no discharge, nothing. Yet she was ready to bombard her body with powerful drugs out of fear. That's the kind of confusion we must fix today. My name is Dr. Chuks. I'm a primary care physician currently undergoing specialization in cardiology. Today, I'm going to show you the real truths about Staphylococcus. Not myths, not fear, just pure facts that can protect your health, your peace of mind, and save you from wasting your hard-earned money on unnecessary treatments. Stay with me. Before we dive deeper, we need to answer one simple question. What is Staphylococcus really? Staphylococcus, or Staph for short, is a type of bacteria. But here's the thing. It is not some evil invader from outside. It is actually a normal part of life. In fact, about 30% of healthy people right now have Staph living harmlessly on their skin, inside their nose, and yes, even in their private parts, without any problems at all. Now, Staph only becomes dangerous when it sneaks past your body's natural defenses, like through a cut, a wound, or when your immune system is weak. When that happens, it can cause infections like boils, abscesses, pneumonia, which is infection of the lung, or even some blood infections. But most of the time, Staph is just minding its own business. That is why finding Staph in a urine or vaginal test doesn't always mean you are sick. Understanding this is the first step to protecting your health and avoiding unnecessary panic. Let's explore some myths about Staphylococcus. Myth number 1. Staphylococcus is a sexually transmitted infection. This is completely wrong. Staph is not an STI like gonorrhea, syphilis, or chlamydia. In fact, you can get Staph from everyday activities such as shaking hands, sharing towels, sitting on dirty surfaces, even scratching your own skin. It is not spread through, or mainly spread through, sexual activity. Staph bacteria live naturally on our skin and inside our bodies. Yes, close contact like sexual activity can sometimes transfer the bacteria from one person to another, but calling it a sexually transmitted disease is just plain wrong and misleading. If you have Staph, it doesn't automatically mean you caught it from sex. It could simply mean you touched a dirty surface or even your own skin. Now, understanding these truths alone can save thousands of people from unnecessary shame and fear. Myth number 2. If a lab finds Staphylococcus in your urine or vaginal swab test, you must start treating it immediately. Wrong. Very wrong. Here's what most people don't realize. Sometimes when you go for a urine or vaginal test, the sample gets contaminated simply by touching the skin or the environment. And since Staph naturally lives on your skin, it can easily show up in the test even when you are perfectly healthy. Lab reports are important, but they don't tell the full story. A real infection needs symptoms. Symptoms like pain, fever, pus, redness, or even swelling. If you have no symptoms and you feel fine, treating based only on a lab report can do more harm than good. You could actually wipe out your natural body defenses or even cause antibiotic resistance, a place I'm sure you don't want to go. That's why smart doctors always say, treat the patient, not just the lab results. Myth number 3. Staph infection will destroy your fertility or cause erectile dysfunction. False. Very false. Let's break it down properly. First, let's talk about infertility. Most cases of infertility, both in men and women, are caused by sexually transmitted infections like gonorrhea and chlamydia. It could also be caused by hormonal imbalances, blocked fallopian tubes in women, poor sperm quality in men, age-related fertility decline, and some other conditions like endometriosis and fibroids. Staphylococcus is not a major cause of infertility unless it leads to a very serious infection like abscesses in the reproductive organs, and that is a very rare thing to see. If you are not having strong symptoms like heavy discharge, pus, fever, or unbearable pelvic pain, finding staph in your test does not mean you are infertile or you are going to be infertile. When we talk about erectile dysfunction, on the other hand, what most men fear is simple: my manhood will stop working. But I want you to listen carefully. Most causes of erectile dysfunction have absolutely nothing to do with staph. Real causes of erectile dysfunction include things like high blood pressure, diabetes, poor blood circulation, obesity, smoking and heavy alcohol use, hormonal imbalances like when you have low testosterone, then depression, anxiety, and severe stress, and also some side effects of some certain medications, and definitely not a simple staph result from a lab test. In fact, many men struggling with erectile dysfunction have never even had staph infection in their lives. And by the way, stay tuned because I will soon release a special video on the real causes of erectile dysfunction and how you can protect your manhood naturally and confidently. If you haven't subscribed yet, now is a good time to do that. Hit that subscribe button and turn on notification so you don't miss that important video. Fear kills. It kills faster than any bacteria. Knowledge protects. It protects relationships, restores confidence, and secures your future. So now you may be asking, Dr. Chuks, what should I do if my lab test shows Staphylococcus? Here's the smart way to approach it. Check for real symptoms. Are you having fever, pain, swelling, pus? If you feel completely fine, you likely don't need treatment. Don't panic. Don't rush to buy antibiotics. Taking antibiotics without real symptoms can cause more harm, like resistance or destroying your natural body defenses. Talk to a qualified doctor. A good doctor will evaluate your full situation, not just your test results, before deciding if treatment is necessary. Practice good hygiene. Simple habits like hand washing, safe sex, and clean clothing reduce your chances of any staph causing problems. Boost your immune system naturally. Good nutrition, sleep, exercise, these things make it hard for harmless staph to become dangerous. Now, the bottom line here is a positive staph test alone is not a death sentence. It is simply a message. So check yourself carefully and work smartly with your doctor. Panic doesn't heal. Fear doesn't protect. Smart action saves health and saves you money. Today you've learned the truth. Staphylococcus is not a sexually transmitted monster. A positive test without symptoms does not mean you are sick. Also, staph is not the automatic cause of infertility or erectile dysfunction. You've also learned that fear, not bacteria, is what destroys more lives, more relationships, and more futures. Today, you've become wiser than fear. I want you to share this video with your friends and your family, and also your loved ones, because false health beliefs have destroyed too many lives already. Let's rebuild our health with truths, not with fear. And don't forget to subscribe and turn on the notification bell, because more life-saving truths are coming your way. I am Dr. Chuks, and I'm committed to giving you knowledge that heals, protects, and empowers you. Stay smart, stay healthy, stay free.